Good afternoon, Warriors. My name is Eric Burgess here on behalf of Kennedy's Village, here with my wife.
Shavonn Burgess.
And we are here today to talk about going back to school for our sickle cell warriors in the midst of this pandemic. We got a couple of special guests here in the building. I have Beth, who is a school intervention specialist for CS Motts Children's Hospital, covering pediatric hematology, oncology, blood and marrow transplant as well. And I have Medjie, an adult sickle cell warrior who is also a medical school student. We may have a couple of guests popping in as we go along, but for right now, I would like to toss this over to our panel and allow them to introduce themselves. So let's start with Beth. Beth, would you like to introduce yourself, please?
Thanks. First of all, thanks for having me. I'm really pleased to be joining, and this is such an important topic for all the warriors out there. So thanks for having me. As Eric and Shavonn mentioned, I'm Beth Stuchell. I'm a school liaison at Motts Children's Hospital. So my job is to bridge the gap between school and hospital. I'm hoping today to just do a quick little talk about what are on our parents' minds right now, which is, what am I supposed to do when it comes to school? So hopefully I can give you a little bit of insight into what I'm hearing from our families in our sickle cell clinic, and maybe hopefully give you a couple little nuggets to take away to think on.
Awesome. And thanks for using Bridging the Gap. We here at Kennedy's Village like to use as our motto is Bridging the Gap between sickle cell research and care. So that's awesome. Thank you. Great minds. Medjie?
Hi, so my name is Medjie. I am a sickle cell warrior. I've been doing this thing for 34 years, and I just started medical school at Wayne State University. It's been quite the journey to get here, and to hear that Elizabeth is a school liaison, that's awesome, because when I was coming up in school, I didn't have that. And so I had a lot of days that I missed school and in college. So like, it's really been a long journey to get to this point. And so I'm happy to hear that there are some resources that are in place for our students.
Absolutely. You made it. You persevered, and you're still persevering.
Thank you.
I just call her doctor now.
Awesome. So we thank you for being here. So without further ado, just want to do a quick introduction as to who we are at Kennedy's Village. And I'm actually going to pass that over to Shavonn and allow her to introduce our foundation and go from there.
All right. Well, we are Kennedy's Village, where we were inspired to start Kennedy's Village in April 2017. It was a year after our youngest daughter was diagnosed with sickle cell disease. She was diagnosed at birth. And so I tell the story on our website, kennedysvillage.org, about how I got a notice of Kennedy having sickle cell disease in a letter in the mail in the post office parking lot. And from there, somehow wheeled myself out of the post office parking lot and got home. And really, she started having issues with sickle cell from 2 months old. It was literally after we had, as parents, had a meeting with the Sickle Cell Disease Association, the Michigan chapter. We had an information session one earlier that week, and the statement was, if they have a fever of 101 or higher, please take them to the ER. And within that week, she had her temperature. So we were listening. We took her to the ER, and we have been battling. She's been battling sickle cell ever since. So the thought process of, you'll have the fetal blood, and you may not have issues with sickle cell all the way up until you're in elementary school, which is what some people said. We did not have that story. Our story started off when she was about 2 months old, and from that first hospital stay, we realized that there were some gaps in some areas, and we were asking some questions, and doctors were saying that the reason why this isn't happening is because we don't have the resources. And we thought, we want to be a part of trying to find the resources for families. And so, and trying to make sure that there's more conversation about sickle cell disease, and also want to bridge the gap between research, because a lot of times I think we as parents don't know what's happening with the research that's happening out there. And so we wanted to be a part of that. And so we started. Took us a year after, like I said, after Kennedy's birth, and then we really started to hone in on her village, which is not just for Kennedy, but the village of people who are also conquering sickle cell disease.
Awesome. All right. Well, I think that's a great place to actually get into some of our questions here. So let's start with, for those who don't know, what sickle cell actually is. So Beth, I'm gonna have you take that, and then Medjie, I'm gonna have you add on to that as well. Okay.
Okay.
All right.
I kind of feel like our pre-doc here could handle this question. What typically, and I want to, I'm wearing my school liaison hat as I'm talking today, as I want to, I talk to schools all the time. And, you know, I go to schools, I'm Zooming with a lot of schools right now. And what I try to explain to them is that it's invisible, but it's there. And our patients with sickle cell disease, they look fantastic and look complete, just like everybody else in their class. And that's what they want. And that's what their parents want and their caregivers want. But inside, there are things going on that aren't happening with their friends. So often what I try to talk about is that, you know, this is a diagnosis that was made when they were itty bitty, typically when they were born. And this is something that's happening in their blood. I talk a lot about for teachers and school staff and things like that, I say, you know, their body produces these cells that's where sickle comes from, as we talk about them looking sort of like a C shape. And I said, think about this. In most cases, a blood cell is donut. It's nice and round and it bumps off other ones and it's comfy as it travels through all those blood vessels and it just makes its way naturally to places. But when those blood cells are shaped in that formation, that C formation, you know, they're going to catch each other. They're going to clump to each other. And when that happens, that hurts inside. And so, you know, I have a million cartoons and a bunch of pictures. But in the end, I often just say that, you know, pain for me that I would put on a scale of 1 to 10, I would say was an 11. Kennedy might put it at a 4. This is pain that she can feel pretty regularly and chronically. And things like heat or things like intense cold or a bump or a bruise can make things feel even worse. So I think for me, it's just, I often am really stressing to schools that these cells are produced in a way that the kids can't control, and it hurts when they get stuck, when they traffic jam, as Shavonn and I, we use the same analogy that I'm sure I stole years ago too, is you know, think about it's not a nice big laned highway with these blood cells traveling comfortably and moving. They're crashing into each other, they're running into each other, they're clumping up on the side of the road, and that hurts, and that gets in the way of you being able to concentrate. You hurt, you might feel run down. And those are a lot of the language I use with schools, that I get some head nods at that point, because I think it sort of starts to sink in that, oh yeah, okay, yeah, I've had a headache before. Oh yeah, I've you know, had a crummy day where I've had the flu. And my argument is, yeah, those days happen more often for our school age kids who live with sickle cell.
Mm, great point. Great point. Medjie, let's get you in here as well.
Okay.
What about that?
Okay. So sickle cell, as she stated, it's I don't want to get too medically, but you know, it's an inherited blood disorder in which the red blood cells are sickle shaped. Like I describe them as a half of a moon shape. And so, you know, as they travel through the blood vessels, they tend to get stuck and clump together. And so when that happens, it causes a lot of pain. And if I can talk about from my personal experience, like that pain is, I really can't describe how it is, but it's definitely something that nobody can understand unless you have sickle cell. I've tried to describe it to my mother, you know, who it was like is my rock, because she took care of me really, really good. And she still doesn't understand what I mean when I'm in pain. You know, so it's something that I've just learned to deal with and just to live with. Like I was in pain last night. And one of the reasons why I was a little late to the meeting was because I literally laid in bed all day today. And I'm like, I have to get up. I have to get up and go on this Zoom meeting. And so here I am. But as Elizabeth said, like it's it's just excruciating.
Mhm.
And there needs to be some, like more resources or just something that can help us alleviate the pain other than the medication that we're prescribed.
Yeah, yeah. And isn't Wayne State's mascot Warriors?
Yes, it is.
How aptly fitting, huh?
Yeah.
Awesome,
Yeah.
awesome, awesome. Well, thank you so much for sharing not only what sickle cell is, but also your story and how it affects you and being transparent in that as well. So I do want to go into another quick question as well. And I'll put this out to the entire panel. So, answer how you see fit. I'll put you both up on the screen. So here we are. How can COVID-19 impact sickle cell warriors and during today's pandemic?
I can start. It definitely can impact sickle cell warriors. I think one, with our immune systems. So because our immune system is already compromised, it's like we're putting ourselves in a dangerous, like a war zone. It's
Hmm.
like COVID-19 is a war zone. It attacks anybody, right? But for somebody with sickle cell, it's like it's a double attack. And so I always tell my friends with sickle cell, like, make sure you're doing things and eating things that are boosting your immune system. And if you have to go out, maybe send someone to go to the grocery store for you, or like stay at home. If you don't have to go, then don't go outside, because it was, a lot of people died from COVID-19,
Mhm.
people with normal immune systems, and they went past, unfortunately. So imagine like what it does to someone with a compromised immune system. And not only that, like it's just the mental aspect of, not being able to go outside.
Yeah.
Like that also plays on any of us, so I just, for me, I just try to like just do the things I know to do, to keep my sanity during this pandemic. Like I'm in school, but it's all online. Like I'm not used to that, you know. So it's definitely a challenging time, but I think we can all get through it.
Yeah, absolutely. Beth?
So I think the first thing I want to acknowledge is how devastating COVID has been to communities of color.
Mhm.
And that to me has made me more just fired up about hoping that I can do my best by the patients and families that I work with, because you're right, it's isolating, and it's for communities that need to, for schools to be open, for communities that need the resources that schools can provide. I am heartbroken every day when I talk to our sickle cell warriors. Moms calling me crying because they can't get a device.
Hmm.
Parents
Mhm.
frustrated because where they live, they do not have consistent internet, and they feel even more isolated than they did before. So there are so many, it's like these tentacles are out there impacting so many aspects of folks' lives. And in my role, I want to stay in my school liaison lane, is I'm seeing how parents aren't leaving home, their incomes are impacted, their kids are not leaving home, their mental health is impacted, their education is impacted. And this is unprecedented. This is doing something to our collective psyches that I can't imagine. We're going to need each other
Mhm.
at the end of all this. But I think from my wearing that school liaison hat, this has been, just watching our warrior family struggle has been, like I said, fired me up to do whatever I can possibly do, lend a voice to ensure that schools continue to provide equal access regardless of a child's health need or educational need.
Yeah, I think what I notice a lot of times, it's really awesome that you both have mentioned the mental health side of things, because that's so huge. And I'm noticing a lot more, like when the times we get to watch TV, the times where you're seeing a lot more commercials about let's get out, let's go, let's do. There are more people who are experiencing that, and we've had to have conversations in our personal family about, you know, when, because we live in Michigan, when we were able to go back out into the communities and how we weren't going to do that. And it was interesting to hear from people, like peers of ours or friends of ours, that were like, well, I mean, you can be in groups of 50 people or more or less, like, come to the barbecue. Why won't you come to this event or that event? And having to sort of be in this your own personal bubble while everyone else is sort of popping their bubble is not really easy to do as adults. And I know for us, it's like, I'd really like to go do that, but just
Yeah.
knowing that you can't do that for adults. So I know that people with sickle cell are already sort of living in their own personal bubble without COVID. And then adding COVID to it, and adding sort of like this COVID, what I call COVID fatigue, to where people are just like sort of tired of being in the house and going, well, forget it. And having to sort of stand strong in your own bubble while everyone else is popping theirs is really difficult. And I know it's been really difficult even for our child, who, like, our warrior is 4 and she is not in school. And I know we'll get to this, but we had to make a decision whether she would go into the classroom or not. And watching her literally tear up because she wants to get out the house, and having to figure out how we're going to make the backyard really exciting. It's just really, something that I really have noticed a lot with this pandemic, how difficult it is for people and how difficult it is for us as people who are helping a warrior who deal with the pandemic.
Yeah, absolutely. And thank you all for touching on not just the physical aspect of things, but also the mental. It's important to practice good mental health, especially during times of pandemics, because a lot more people feel more isolated, especially our sickle cell warriors the adults who can't get out, can't invite people over, are skeptical about inviting people over. And then our kids you have to kind of keep them in a bubble because of their immune system. So that's important. And thank you for bringing that up. So one of the questions that is on everyone's mind is, what should our warriors be concerned about going back to school, whether it's physical or virtually? So Beth, I'm gonna have you elaborate a little bit more about that.
Sure. There's so many. It's scary for any family. It is scary for a family who has someone who lives with a chronic illness right now. I would strongly recommend families take a look at the Sickle Cell Disease Association. Has a fantastic return to school PDF that they've created. It's awesome, and it's really nice because I'm starting to hand it out already, because families aren't yet where they're sending kids back to school, but this is a great headspace to put yourself in. It's almost a checklist. Is my school doing this? Yes, no. Okay, I'm going to think maybe yes, and then go through. So I think that would be my first thing. And I know you all have plenty of links to this and plenty of ways that folks can get to that information, but I would strongly recommend Sickle Cell Disease Association's return to school checklist. I would also say that, to put in a plug for CS Mott Children's Hospital, we also have some return to learning plans that we've posted on our website for our families to look, not just families who live with sickle cell disease, but any chronic illness. Our pediatricians have put their heads together to create a return to learning plan. And so families will need to, I often say, be a squeaky wheel, ask questions, be like, does everybody have to wear a mask? Are you sure? What if they don't? How far are they sitting from their friends? What are you doing for lunch? What about bathrooms? So I think there is no shame in asking lots of questions when your district decides to transition back into an on-site setting.
Yeah, that's a really good point. And those things that you're bringing up are very helpful to our sickle cell warrior community, but it's also helpful to those who have a compromised immune system, no matter what their element is. So we'll make sure we get those links posted. And when we put the video up on our YouTube page, we'll make sure we put those links there as well. Pretty awesome. Pretty awesome. Medjie, did you want to add on to that?
Well, like my husband, he's an educator, and so his school has decided for them to go on site.
Get them in here. No, I'm joking.
I'm ready for it, honey.
And so he's been back for about a week now, and he doesn't like it because so they're making them eat outside, and which is an issue for people with sickle cell. You can't be outside. It's getting cold. I had to put my jacket on because I got cold, and I'm in the basement. So his opinion is that he thinks we should all just be virtual until this thing just starts to slow down. And his kids are not happy. Like, they can't touch each other. They can't even hug each other. They have them spaced out when walking down the hallways. He says it's not a place where at this time, school should not be open.
And that's a lot of pressure to put on kids. To have them stay hands off when kids are used to touching. That's how they learn. Kids are used to being around people. That's how they learn. It's very tough, and I know the pressure has to be immense on these kids, as well as the educators and parents as well. This is not easy, and we know it's not easy.
We have two daughters. Our oldest daughter is learning from home right now, and so I have the opportunity of seeing her teacher quite a bit because they have the virtual sessions. And when I say, and it's obviously been a week, but I'm thinking to myself, this woman is working really hard. And I'm not saying that she didn't work hard last time, but the fact that she has in this situation in our oldest daughter's school, they have two different groups of students. So at this school, they are learning face-to-face, and you also have the option of learning virtually. And so she has her virtual students, and she has her students who are learning face-to-face. And that session is being recorded for the virtual students. And then after, when she takes basically the morning session is uploaded to the virtual app that they have by lunch. And then the afternoon session is uploaded once the school day is over. So essentially the virtual students are about a half a day behind, but they're getting those lessons. And I was watching the video, and she has a space where she's pulling names out of this hat or out of this cup. And essentially those are the names of the kids that are virtual. And she's trying to figure out how to make the virtual students still feel a part of the classroom. And so she pulls my oldest daughter's name out of the hat, and she goes, "Savannah, did you say the answer to?" And whatever the answer is. And my kid is pretty young, and she's going, "It's 7, it's 7." And she's going, "I can hear you, I can hear you, I can hear you say 7." And I think to myself, how many teachers are working that hard? And trying to make sure our kids can do that. And those that are working that hard, it's week 1, and I'm exhausted for you. Because she is, and then she pulls the name out of the hat, and she gets that because she has a couple of students whose families have decided that they're going to be virtual. And so basically having to teach the lesson twice, and I'm just using this teacher as a personal example, but she has a Zoom session with these kids. So she has a video, and then she has a Zoom session with these children while the other children are in a different special. And then she meets with them and wants to be face-to-face with them as well. So I just think it's a lot. I can imagine. So just thinking about that, Medjie, it's a lot for educators to try to figure out how to be creative to do this, and how to also make the students feel a part of it. But some of them are working really hard to make that happen. So it's my hats are off to them who are doing that, because I'm exhausted with the one.
Yeah, absolutely. And that actually kind of leads into our next question. So what are some of the long-term and short-term planning that parents and students should be doing for this upcoming school year? And anybody can take that one.
I'm happy to start. I think that what I'm talking to a lot of our families about is to first of all, make sure you have everything you need. So short term, do you have your device? Do you have your Wi-Fi? Do you understand who's teaching your kid? Because I think it's important to think about some of larger school districts are actually sort of outsourcing some of the instruction to virtual teachers that are hired by an outside organization that they basically are buying their support. So what has happened for a couple families is they've anticipated that, Mr. Smith is going to be their kid's third grade teacher, but when their kid actually switched to the virtual setting, there is a virtual third grade teacher. And they were like, wait, where's Mr. Smith? He was going to be my kid's third grade teacher. And they said, well, no, Mr. Smith is in the classroom. This is Mr. Johnson, and he's going to be your kid's third grade teacher. So I think things like that is identifying your point people. Who's your kid's teacher? Do you have a device? Do you have internet? Do you have what you need? And then the second piece would be, if your child already accessed additional supports through a 504, which is a general education accommodation plan, they can still get stuff. So I don't want parents to feel like that they can't continue to access supports through a 504 plan, which is a general education health-related plan. I hope you have one if you don't get one. And then the second piece would be for kids with more significant needs through special education. That's messy right now. And I don't have any good answers other than likely schools need to be continuing to provide your kid with services, speech therapy, occupational therapy, social work, but it's going to look a lot different. But I would empower families to ask a lot of questions. Again, that squeaky wheel thing. My kid gets stuff. How are they going to get it? Who's their teacher? Their device? Who do I call if their tech goes down? I've already had tech families call me with tech, but I don't know how to log in. So kind of making sure those real basic needs, you have a point person for everything right now, I think is where you just don't think long term. I don't know. I don't even want to. My head with our families right now is what can you control? And you can control these sort of check marks. Who's your teacher? Do you have your tech? Do you have your Wi-Fi? Is the 504 plan up and ready? Let's just get that. And then let's talk in a month or two from now when things start to settle down.
I have a question. Are the 504 plans for families being modified? I mean, like, because my understanding of them is like it's sort of a menu or recipe of like, this is what's going to happen, or this is what we can do for your family, and we'll work together with this. But I'd imagine if the child is virtual, if, for example, if the plan is that the child needs extra time to complete schoolwork. Mm-hmm. So if the child, he or she is virtual, are they having an official meeting to modify the 504 plan, or how is that working?
That's a great question. So they're really doing everything over email right now. That's been my experience. Is I've been compiling a list, and I'm happy to share that you can certainly post to, of some virtual accommodations that would add that what might be good for a 504 plan. They don't fit for every kid, but you're right, Shavonn. Additional time, how does that look in when you already kind of have extra time? Mm-hmm. So I'm working with families to be creative and thinking about ways to use the virtual setting. And we've come up with some new kind of virtual 504 plan accommodations, but schools have been doing everything over email. Hey, Burgess, here's Kennedy's most recent 504 plan. Take a look. You want to add anything? Email us back. Yep, looks good to us. Let's put it in place. So it's happening. They can do it. You can do it as parents too. But this is the new way of doing things. But it's absolutely on the table to get 504 plans up and running with some newer ways of thinking through some things.
Makes sense. How does that work for college? Because one day Kennedy will go to college. So I need to know.
Well, hopefully, Medjie has. Have you used Medjie? Any sort of resources from Wayne State?
Oh yeah, absolutely.
Good.
So there's so each university has a student disability center.
Okay.
And so once you get to campus, you will go to the center, and then they'll assign you like a specialist. And then so in the beginning, what happens is that your physician will send all the documents that the student needs for like diagnosis and like things about the disease per se. And they'll send that over to the specialist, and then the specialist will go over what the doctor said, and the doctor 9 times out of 10 will say like, this child needs double time on their exam, or because they might have a crisis, they're not going to be in school for this amount of days. And when they come back, they can do the homework or, you know, complete whatever they missed and for that class. And so I took advantage of that because I would have crisis and, you know, that's unpredictable.
Mhm.
And so if I didn't have the student disability services, I don't think I would have made it through college. Yeah. So there are things in place for that. And I'm currently in the process of getting that for medical school as well too.
Okay. I was gonna ask, you have it for
Mhm.
medical as well.
It's in the works.
It's interesting because now someone was we were sort of joking about the fact that kids may lose snow days forever. Because now, you know, now that all of this virtual learning is up and running, if you go back to face-to-face learning and there's a snow day, instead of having a no school day, you could have a virtual day. And I thought, oh, that's terrible for them. But what I was also thinking about is for families who are, maybe you're having a crisis or you're having some difficulty with sickle cell, because obviously sickle cell is, while pain crises are severe, there's more to sickle cell than the pain crises. You could be in the hospital. And so I'm wondering, with virtual learning, is there something that's happening for people who are like, Medjie, heaven forbid, for some reason you're in the hospital and you go, I want to still participate in my classes. There's some people and some teachers who are requiring you to be on video. I wonder if there's some way for 504 plans or disability plans to say, like, I'm okay to participate, but I don't want to, you don't need to see my IV. You know, you don't need to see me on video. And is there some way to be able to add that to plans to say, I don't, my camera doesn't have to be on, or there should be times when my camera should be on.
Or you don't need to see me in a hospital gown. That too.
Yeah.
Well, that's in place with the student disability services.
Okay.
So it's the same thing as if you're not being like, if you're sick in the hospital, like I can't make it, whether it's virtual or not. I'm just not gonna make it because I'm sick. Yeah. So
they're not like, well, I mean, but you have a computer, so you know, pop that computer up on that food tray.
No.
Okay.
No.
Okay. And you know, I just, because some people are, and I don't mean ignorant in a way where I mean just like ignorant in a way of where they don't understand.
Right.
There's certain people who just don't understand, and so it's like, if this is not a snow day, you can't just say like, oh, well, she can't make it to class, but she should be able to turn her computer on, because even if she's in the hospital or not. So I was wondering what things were like for that perspective.
Yeah, I thought about that too, because it's highly accessible. You just pop, like I said, put the computer on the tray and you're good to go. But when somebody is actively in crisis, or they've been in a hospital for a couple of days because of a crisis, you're not there mentally. Like, right. All you can think about is this pain that I'm experiencing right now at this current moment.
Correct.
You know, so you're not even able to focus. You know, so it defeats the purpose. So
right.
Yeah.
Okay. Also, I want to highlight, for those who don't have access to Wi-Fi, if your school or your kid qualifies for free lunch or student assistance, I know in the elementary, high school, like the grade school level, Comcast is giving out Wi-Fi for $9.99 a month. You have to qualify, obviously, but that is also a resource for you as well in the short term while your kid is at home dealing with virtual learning. We'll also make sure we get a link up there for that as well.
Awesome.
Cool. All right. Well, we're moving right along. So one of the biggest questions that I have been talking to a couple of people coming by, and they always ask me, since I work with the public, what are you guys doing to stay safe during the school year? And obviously our answer is our kids are at home, but not every kid has that opportunity to learn virtually. So what are some of the things that our parents can be doing for their warriors, and our warriors can be doing to stay safe during the school year, whether it's returning from virtually to in-person school full time, or doing like a hybrid system? What can they do to stay safe out there?
I would say this, I kind of want to take one step back from your question, Eric, and say for your warrior families that if you do not want your child to return on site, there are options.
Okay.
So I want you to never feel forced. So if you live, so, you know, we're in all these different regions or in different phases. And so if you're living with sickle cell and living in, let's go way north, Gaylord, north, and your public school says we are on site, there are always options. So I will preface this by saying I've always been I'm not always been a fan of virtual charter schools. So Michigan Virtual Charter School, K-12 online, you see the commercials, they pop up constantly now on your Gmail. But I would say this, those are options for families who do not feel safe with their children returning to school on site. So you always have a virtual option. It will not be through your public school. So you would actually have to unenroll from your public school and enroll in this virtual charter school, but it's there for you. So I think I want to say that first, because there is always the virtual option, and there always has been. We've just never, these schools have been at it for years. We've just not necessarily tapped into them very much, but they're there.
And Beth, I'm sorry, before you go on any further, just so we can differentiate, that is a big difference between homeschooling and public schooling.
Correct.
Even if it's on a charter level. So can you can you explain the difference between the two?
Absolutely. So in a virtual charter school, this is a school. This is, they have their own enrollment. They have their own qualified teachers. You are enrolled in this school. The money that comes to you from the state and the federal government goes to this school. They just don't have a brick and mortar building. That's the only, so they don't have a playground and a driveway, but they have teachers teaching classes. They are doing virtual instruction. They're doing, the buzzwords asynchronous and synchronous. So they're doing synchronous learning where they're right there with you. Hey, bud, I'm looking at you. You're looking at me. But they also do asynchronous recorded lectures, like Savannah's watching lectures later in the day. So they've been at this a while. They create the curriculum. They create the content. They're teaching your kid. Homeschool is tough, but it's a caregiver creating the curriculum, delivering the instruction, right there at the kitchen table, doing the work with their kid. And for some families, that is an absolute right option for them. So again, if a family ever felt that they weren't comfortable with this online charter school or what the public school is offering, homeschooling is an option. And you're buying curriculum from a website, and you're at the kitchen table and you're doing paper pencil stuff. Maybe you're doing some computer stuff, but the caregiver is responsible for the instruction if you do homeschool. Does that make sense?
It does.
Okay.
Yeah.
So it sounds like essentially there's the option of being virtual with your school, with your public or private school or charter school that you attend. There's the option of doing virtual with a school that doesn't have the brick and mortar. And then there's the option of homeschooling, which is none of the above, and it's just the parent and the child. Or because I know that there are some parents who have opted to hire teachers personally, to hire tutors personally. Would that also fit into the homeschool category?
That would be my assumption. Now it could be that these are kids who are still enrolled with their public school or their charter school and they're doing virtual, but the tutor's potentially coming in to provide some extra, face-to-face. I know a lot of, if you have the resources to do that, a lot of families are sharing tutors. So they're creating these pods, and basically a tutor sits in one spot, and then families that feel they can get into each other's bubble safely will come and find time with some face-to-face instruction, because we know that's the best for a majority of our kids is face-to-face instruction.
Yeah.
Absolutely. Absolutely. Medjie, did you have anything to add on to that?
I have an idea, but I would say do whatever you can to boost your kid's immune system. I know that's kind of general, but there are things out there that parents can do, to help their children's immune system. That would be my suggestion, but a lot of people may not agree with it.
Fair enough. Fair enough.
Yeah.
Fair enough. All right. Well, moving right along. So seeing that Shavonn is the only parent here of a sickle cell warrior, I'm going to have her answer this question, and then we'll kind of, well, I'm the moderator, so I'm out of this. I'm just here to host. No. So, well, I guess we've already kind of touched on this before, but we know that our kid is here being taught from home, and so is her older sister, but she's enrolled in school. She's just getting her lesson plans virtually. So I'm going to have her expound upon the fact of what led her to that decision. So go ahead.
Oh, because I said so. No,
that doesn't work.
I think before, just not to talk about me personally, I think that one of the things that is sort of hard for me to reconcile is having to make that choice and not being able to make that choice. I feel really blessed to be able to say that I have an employer that allows me to work from home, where I can make the choice that my kids can also be at home. And obviously I could go the route of FMLA and things of that nature and throwing on my my advocate cape and saying these are things that I can do, but I'm glad to have a space where I do have the ability, and I work on a team where I can do that. I think that one of my biggest concerns are for the families who, especially in communities of color, where they don't have those options. And I know we have the options of doing the different types of school that we're talking about earlier, but I think that if you work in a space, and I'll use our own family as an example, if both of us had jobs like Eric's, that were 12-hour shifts where he had to be at work at 7 a.m. and then get off to 6 p.m., jobs where there are jobs where you don't work, you don't get paid, jobs where if you have very limited vacation and sick time, and where essentially a sickle cell warrior is a whole person. And I say this all the time. They also have to be fed. They have to go to the doctor's appointments and they have to go to school, but they also have to be fed. And sometimes you have families where there's one parent or there are two parents in the household where they have to go to work. They don't really have the option of not going to work. And so I realized that we are blessed in the area where there's one of us in that situation in our household, but then there's one of us in our household that is not, that can actually make the decision of being able to be at home. So I don't take that lightly. And I am sort of annoyed by the systems that we have in place, a lot of system issues where families who don't want their children to go to school, but have to work these 12-hour shifts, and there's no one to stay home with them. So even if they had homeschool, or if they decided to do virtual, they are trying to figure it out. And so now there are these situations where they end up in latchkey, because we have latchkey programs that are like, okay, we know you have to go to work, so just bring your child to us all day. They have these latchkey programs and things of that nature. And so they're put in a situation where they're essentially having to decide between their child's education and feeding their child, and their child's safety and feeding their child, or clothing them and housing them. And I think that a lot of our families are in an unfair situation where I know that we talk about like front workers on the front line, and we talk a lot about people in hospitals, and obviously we care deeply for our hematology team. But I think frontline workers are people like my husband, people who had to go to work when I was at home in a bubble, and he had to go to work because he was considered a frontline worker. The janitors, the bus drivers, the people in those positions that still have to go to work no matter what. And now they're trying to figure out school. And so my heart goes out to those families, and I wish there was more resources for them. For us, because we're not in that situation, I was able to look at some research as it relates to Kennedy and as it relates to her, not just her diagnosis, but her journey with her diagnosis. Because I know sickle cell warriors who are getting education face to face. But they haven't had the same journey with sickle cell that we have had with us. So I think that that's also a difference. Like I said, she's had a journey since 2 months old. And so there are some things in her own particular chart that would impact that we felt like, I don't think she's ready for to be out into the community and her age, because as my husband said earlier, she is a preschooler, and preschool, all you do is hug and play and touch people and touch things. And so to say to her, go here, don't touch anybody, stay in your bubble, keep your mask on, don't move, but enjoy school. We were just happy that we were in a situation that she didn't have to do that. And so I think there are a lot of factors in if your child is going to be face to face or not. And I don't think that it's wrong if someone with sickle cell decides my child is going to go to school, because again, their journey is different. And I don't think it's wrong if someone says my child is going to stay home because their journey is different. Because like I said, it depends on your medical history, your age. Can you handle this? And so for us, we just felt like our 4-year-old, in the way she's supposed to be educated, could not handle it. And then also, thankfully, I pretty much can tell her how I can keep up with the preschool education, so I can homeschool her. Now, if she was in 7th grade, we might be having a different conversation. But I can keep up with, ABCs and, numbers and shapes. And so that's how we ended up making the decision that she would stay home. I think, not to make this a long answer, but there's also the other space where you have the other people surrounding her that need to be able to stay home. And so she has a sister that we talked about before. And so then we needed to make a decision as to what we would do with her. Would we allow her to go out into the community and her to come back in? And what that does for her mental health if we say, you can't go outside because Kennedy can't go outside, and we don't want you to get Kennedy sick. And having to figure out how to say that to her differently. And really the culture of our family is about family and staying together and working together and taking care of each other. And so how do we have that conversation with our older child to say, we're going to stay in. Daddy has to go out because that's the way his job is. But we're going to stay in, and we're going to keep each other safe. Everyone safe, not just Kennedy. But this is what we're going to do. This is how our family may be different. And so I know that's a really long answer, but I think that that's what we did for our family. But I understand that there are other families who do not have that privilege. And I get that in that area, and it's sometimes weird as a Black woman to say that I'm privileged, but in that area, I do have that privilege. And I'm grateful for that.
Mm-hmm. Yeah, and Medjie, so with Wayne State, what is their rules right now as far as on campus? Is everyone virtual? Is there a limited amount of people who are allowed to come back to school? How was that handled?
So right now it's a hybrid.
Okay.
And so I'm a first year, right? So the second year medical students, they have lab and research and so they're allowing them to come to campus for anatomy lab. You can't do virtual anatomy.
Right.
Like you can't do virtual histology. Like it's just impossible. So exactly. So so it's hybrid.
Okay.
Like my anatomy class will start maybe in January, and then they already told us up front, like you're gonna have to go in.
Mm-hmm.
For that class. It's impossible to do it online. Okay. But before August though, everyone was virtual. So they're slowly like opening up, as time goes on. Right now it's a hybrid.
And do you know what they're actually what's helping them to make that decision from going from everyone's virtual to slowly, gradually opening up? Is it data and research based, or is it, we just have to make sure we protect our students so we can give them the best quality education they can get? Are you privy to any of that information there?
So I think it's a combination of they have to protect the students, but it's also the simple fact that medicine is hands-on.
Yeah.
Like you know, some aspect of it is hands-on, and so earlier, like January through, so when it first started, right?
Mm-hmm.
Like around in March, they shut everything down, but was it wasn't beneficial to those students, and there was a lot of complaints because you have to take boards, and so it was really tough, and it was a lot of students saying, well, how can I successfully complete anatomy if I can't even see what I'm looking at and the cadavers and all those things. And so it's a combination of protecting the students, but also like realizing that you just have to simply be at the school. Like, so to protect the students, they have like an on-site screening where before you go every day, you have to complete this questionnaire. It's online, but you have to complete this screening. And once you complete it, then you can come to campus, but it's every day. So that's how they're protecting the students.
So it's interesting you bring up that screening. How does that screening work? Is there a dedicated entry zone where they have people checking for temperature, signing off on things, or is it on the honor system?
Yeah, so it's the honor system. So I haven't used it yet because I haven't had to go, but we're supposed to be going next week for a hybrid session. But when I looked at the screening, it's basically they ask you questions like, have you had a fever within the last couple of days, or how high was it? If you've been in contact with somebody that has COVID. So they have like different questions. And if you, like I said, honor, if you answer those correctly, then you can come to campus.
Mm.
Yeah.
And one last follow-up question, and you may not be able to answer this, but how does that in itself make you feel as a sickle cell warrior conquering this every day?
It's tough because like I know I have to stay healthy, like, period, so I haven't had to go in, so I haven't really thought about it just yet, but I also don't want to cheat myself with my education because this is also a passion of mine, and it's tough.
Yeah, yeah. I can tell
Yeah.
that puts you under immense pressure. So we're here to support you in whatever
Yeah.
way we can. We're praying for you, and
Thank you.
hopefully this thing gets figured out a lot sooner than later. But I
Yeah.
definitely want them to take their time because no one needs to rush back into any of this. So
Yeah.
we're getting ready to come to the end of the Q&A. But Beth, you had a couple talking points, and I think we hit a few of them here. But one of the things that I wanted to highlight that I know we did not really go over was how to access the supports and services with IEP or special education. So can you briefly go over that for us real quick?
So a quick review. So special education, oftentimes for warriors, the reason that they are receiving special education is likely because they qualify for additional services under a health impairment. So quickly, the special education, in order to qualify for special education, there's 13 very specific designations. So for example, if you have low vision or no vision, if you're blind, you would qualify for special education.
Mm-hmm.
If you had a hearing impairment or were deaf, you would you would be able to access special education. In the case of sickle cell, because you're likely there's been enough health impacts on your learning, absences from school, things of that nature. Some, not all, but some students qualify for special education. There might be some other coexisting factors that help with that qualification. For example, maybe struggles with attention or a learning disability may kind of make the whole basket or the bucket, and then qualifying for services. Mental health as well, so depression, anxiety, things of that nature. And so for students who do access special education, it's really messy right now. And so what a lot of families are doing is they're waiting, and I would encourage families not to wait. You have a copy of your kid's individualized education program. You've got it somewhere. You've got it in an email. You've got it printed out somewhere. Look at it and say, okay, it says on here that my kid sees a social worker for 15 minutes, 3 times a week. Okay, so they need to keep seeing a social worker 3 times a week for 15 minutes. How's school going to do that? Or, oh, it says here that my child participates in classes that are taught together with a general education teacher and a special education teacher because they have a learning disability in math. Okay, so how are you going to do that for me, school? How are you going to make sure that my kid who has a disability in math gets what we legally agreed to on this sheet of paper? And I would say this is going to take a village to make this happen for kids. This is not you versus school, school versus you. They are just as confused and messy right now as you are, families. So I would say, please, but don't sit back and wait for those supports to happen. I'm working with a patient right now who accesses speech, physical therapy, and occupational therapy just because of the intensity of the symptoms and the pain and everything that's hit him so hard for so long. He gets a lot of great services in school, school-based therapies. When you're not in school, how do those things happen? So I would encourage families to call the school and say, I haven't heard from the physical therapist yet. Are we doing a session this week? Are we going to Zoom? How are we going to make this happen? Ask. Don't be afraid to call, be the squeaky wheel, ask questions, say, when are we having these sessions? And school may honestly say, we don't know. We're not sure. We're still trying to sort this all out. And that's okay, as long as you keep that conversation happening with school. There are a lot of good advocacy organizations. If it got to the point where you felt like, I haven't heard from school and it's a month in and my kid gets occupational therapy. So it's going to happen, but I wish I had a good, clear answer about all this, but we just don't know right now. But schools know they have to provide the services. That's not, we're not even talking about that. They have to. It's just they're starting to figure out, and they need to figure out how.
And I would say for families trying to navigate that while navigating everything else, because your warrior is a whole child, is not, that can't be easy having to do that. And I know one of the things that I do is everything is in my calendar, in my phone, in my calendar. And for some stuff, I even put alarms on them to really kind of map out, when am I going to make this call about this, or about when am I going to set up this appointment? And so I try to, because sometimes in my mind, I'm thinking, I'm going to call to set up, her audiology appointment. But then it's a week later and I'm like, oh my God, I never did that, not because I was like, watching TV and knitting sweaters, but because, there's other things that we were, that we actually had to do. And so I put those things in my phone and put alarms on them. And even if I have to reschedule them because the time I put the alarm in, something else came up, I can then reschedule it. But having a sort of a to-do list, a checklist, for me at least, has been really helpful. I don't know, Medjie, has that been, what do you do to sort of keep, and because you also have children, so what do you do to keep up with all of this?
So yeah, I utilize my to-do list like it's just my best friend. Like if I like every day, like I'm checking up, did this, did that. Like, if I don't have it, like I'm not gonna be able to function. There's so much on my plate, with school, and like you said, I do have a toddler, and my role as a wife, like you have to, be proactive with doing these things. Like even with my appointment that I made with the Student Disability Service, like I didn't want to do it because it's like, man, I have so much stuff to do, but I had to do it. Like who's gonna do it for me? I'm not 12 anymore. So
I know sometimes we wish we can go back, right?
Yeah, absolutely. So I would just like Elizabeth said, like be really proactive in those things when it comes to those resources. Because if you don't reach out, they're not going to reach out to you more than likely. You have to speak up. Mm-hmm.
Be a squeaky wheel, as she says.
Yeah.
Awesome, awesome, awesome. Well, I think we're a little over an hour now, and this is probably a good place to get ready to wrap up. So we'll open it up to the floor really quick. If there's anything else anyone would like to add, we can go ahead and get that out there. If there's any questions you would have, we'll go ahead and get that out there at this time, and then we'll get ready to wrap up. So Medjie, let's start with you. Did you have anything else to add? Any questions, any concerns?
No, I just wanted to say thank you. Like, I'm honored to even be on this platform with you guys. Like, it's just, I am flattered by what you're doing with Kennedy's Village, because I remember when I was growing up, I didn't have that support. It was just my mom, and you know, we're immigrants, and so she didn't know to give me an IEP or any of those things with the language barriers and everything. So the fact that you guys are doing Kennedy's Village and providing those types of resources, that's amazing. You know, it'll help a lot of other children, and I put my hats off to you guys. So
Thank you. Thank you.
Yeah.
Thank you for being here.
Thanks for having me.
And I would just say, same thing. Thank you so much for including me in this conversation. I have the honor and the privilege to work with families at the hospital who live with sickle cell and live with beta thal. And I would say that I am humbled and amazed on a daily basis at the living, having someone in your home or multiple generations with a chronic illness. It makes folks stronger than they know they are. And Kennedy's Village has been, I love what you do, and I get to see the things you do that you don't tell people you do, but you do. Especially you do some really cool things, and I know you don't shout it as loud as you should, and that's why you're great. But I would say that just to thank you for this opportunity, and just reminding families that be patient, have grace with schools for this school year, and we will see ourselves out of this and get our schools back, our education back, our kids back, their mental health back, their physical health back.
Absolutely.
But this is where we're at right now, and I appreciate everyone who has tuned in, and I'm again grateful for the opportunity to speak with everyone today. Thank you.
Awesome. Thank you. And Shavonn, I'm going to throw it to you real quick. And then also, it's probably a good idea to touch on the fact that we did have a great opportunity just recently to partner with the organization to help out with back to school. So why don't you talk about that briefly on this?
You want to send me a text message and tell me what you're talking about? No, I'm kidding. Well, actually, I have, I like to say that I sit at the kid table, but there is a adult group called Sickle Strong that Medjie actually connected me with, and I learned a lot from them, just sort of sitting back and listening to what's happening in the adult world. I think that I think kids are cute, and people like to help kids because they are sweet and they're cute and helpless in a sense. They, you know, that there are certain things they can't do for themselves. But there's this there's the adult world of sickle cell disease that I am not I was not as understanding about, because I do have a 4-year-old, and so she opened up this door for me to be a part of this this world, and so I sort of sit back at the kids' table and just sort of listen and watch. And they are sponsoring 8 children with backpacks and things for the school year and school supplies, and they wanted to get them laptops and tablets and things that would help them to be able to conquer sickle cell while at home. And Kennedy's Village were able to work with our corporate sponsors with Microsoft and to donate those tablets. We donated 2 tablets ourselves from Kennedy's Village, and then we were able to work with our sponsors to donate the other to 6 laptops. And that's happening actually right now. As we speak, they are picking up their laptops and their backpacks and their tablets. And we're just happy to help those 8 kids that are conquering sickle cell, and they're going to do it virtually. and we're believing and we're rooting for them that they're going to do it well. So we're really excited to be able to work with Microsoft in this and to be able to help them. Like I said, our corporate sponsor reached out to us and asked if we knew anyone that any kids that were in need, and I had the privilege of talking to them about the needs of the sickle cell disease community, and then they sent me 6 laptops. So we're really excited about that, and like I said, they're getting those laptops as we speak, so that's really cool.
Absolutely. Big shout out to our board members who had to fill in for us during this time while we were here. We had this scheduled. There was a scheduling conflict, but we have a tremendous board. So shout out to Cindy and those who helped out as well. So thank you so much with that. And I guess we'll go ahead and again do just a brief outro really quick of what you do. And if you want to throw out any social media information, you feel free to do so, or any links or websites, feel free to do so to where people can find those resources. And then we'll go ahead and wrap this up. So let's start with you, Beth.
I would definitely say the Sickle Cell Disease Association. I'm plugging them. They have some great resources right now around returning to school, return to learn planning. I would also say the Michigan Department of Education, and then my home, which is CS Mott Children's Hospital, is also providing a lot of COVID, where the doctor lives. No, where the doctor sleeps. What does Kennedy call it? Where the doctor lives?
House.
The doctor's
house. The doctor's house. Our website has a lot of good and I feel like patient-friendly resources to help navigate. And then I would say this: call your doc, call your social worker, call your nurse practitioner. We want to help you talk through decisions for brothers and sisters and for kids. Don't be a stranger for any sort of resources or questions that you have around COVID. Use your team to help.
Awesome. Really, really well said. And go blue again. Medjie, let's go to you.
Well, the only thing that I want to say is that like I'm in my journey, like I'm starting my journey. And I aspire to be a hematologist. I'm still trying to figure it out, but it's between like psychiatry, but focus on hematology. So helping those that are affected by sickle cell in their mental health. And I truly want to give back eventually. Like I'm trying to work all that out. But if you want to follow me on Instagram, you can follow me at Dr. Medjie. So that's DrMeedjie.
Awesome.
So,
awesome. And we are Kennedy's Village. You are now listening to the COO of Kennedy's Village, but titles mean nothing to us. I'm just a co-founder here trying to help out. And my wife is, although she is the CEO, she is definitely the backbone of this organization. And you can find us at www.kennedysvillage.org. You can also find us on Instagram, Facebook, and Twitter at Kennedy's Village, where we're doing our best to bridge the gap between sickle cell research and care, and helping to reshape sickle cell across America, as well as hopefully the globe one day. And with that, guys, I think that is a great place to end. Thank you so much to our panel for joining us today. Thank you for giving me the opportunity to ask you a series of questions, some rapid fire style, some not so much rapid fire style. But thank you so much for this opportunity. Thank you to my wife for giving me this opportunity to do so as well. Did you have anything else before we head?
No, you did great.
All right. Well, with that, we're going to end the recording.
As my husband stated before, thank you so much for joining the conversation. You can follow us on all forms of social media at Kennedy's Village. That's Facebook, Instagram, and Twitter. You can also find us at kennedysvillage.org. Again, thank you for joining us and have a great day.